Morning everyone, I'm Farizal Muharram from Universitas Airlangga. I will present about our research paper with the title of Anxiety Level and Compliance with the Health Protocol in Universitas Airlangga students during the COVID-19 pandemic. This research is held by our team. I'm the corresponding author and I'm with my team, Nur Imroatul Mursyidah, Disma Ilma, Haidar Ali, Reza Kurniawan, Indah, Anastasia Patty, Ineke Septya, Sita, Aini, and our lecturer, Dr. Azimatul Karimah and Dr. Margarita Maramis. All of us come from Universitas Airlangga. Let me introduce our research. In the end of 2019, the new disease called COVID-19 or coronavirus 2019 infection originally sourced from the SARS-CoV family, similar to MERS and SARS, and have similar manifestation with a typical viral pneumonia. At the end of 2019, the virus spread from the Wuhan to another country. In the March, it already spread to the 100 countries and declared as pandemic by WHO with the 10,000 cases in the world. In the July 2020, the case is already 9,000 cases in Indonesia. Now the cases already got to the 2 million, and the July is the catastrophe month for Indonesia. The Delta variant is nearly make our healthcare system collapse. So the reaction of the pandemic from Indonesian government is issued a new regulation called New Normal, the era with the new health protocol. The protocol is first is wearing a mask when going out, keeping a distance with the people, consuming healthy food, using hand sanitizer, and etc. And it's a need community compliance to prevent transmission and control infection, and complies to the new protocol from the government. In the June 2021, the case is already 180 million cases in the world, and Indonesia is already 2 million cases. The long pandemic make the people bored with the regulation and the health protocol that already used, and it's make the people to going down and lowering the health of compliance protocol. So we make the research. Of the background, we already know that with the long time of pandemic and many changes as new habit and new protocol, it make people shifting from protocol compliance. In introduction, we found the main problem. The pandemic has an impact on a multiple aspect: public health, economic, and social aspect, and psychological impact. The physical impact from pandemic such as many people are laid off from their job. Health workers work harder than usual, people don't get a job, and the student must study alone and they don't meet their friend will cause prolonged stress. It's added by the misinformation, or we call it hoax or fake news that spread around the corner, making more confusion and economic instability and lowering the health compliance. And that is just, and that's the truth. And the death of family and close friends lead to the anxious, and that are the main reason of our research to determine the correlation between anxiety level and compliance to the health protocol during the pandemic of COVID-19 in Universitas Airlangga student. Okay, for doing the research, firstly, we are doing the literature review, and we found that there are three main problems. The first is pandemic anxiety. It's distinct signs. It can arise either from contracting, transmitting of new disease, concern about close person who may contract the disease, and loss of the close person. Pandemic anxiety also impacted the social, educational, occupational, economic impact. Among college students, anxiety is more prevalent than other mental problems. More studying alone, which result into isolation, in the social and not meet the friend, the lack of interaction and emotional support, and physical isolation, all associated with worsening of mental health. The second point is the fact that pandemic changed many aspects of life, including the health behaviors. People travel less due to the teleworking and e-learning. There is an increase in hygiene practical, lowering in physical activity, and lowering the healthy eating habit. All of them positively comply with the recommended protocol. However, the different population will have a different compliance depending on the specific factor toward the population. It is evidenced by the contact dictionary result with a regard of health behavior during COVID-19 pandemic. Some found there is a decrease in smoking activity, an increase in the physical activities during pandemic, while another found the opposite. The third and the last problem we found is about health compliance, which is a complex phenomenon influenced by multiple factors. Among many factors, the fears of COVID-19 is significant in influencing people to comply with the health protocol. However, anxiety was associated with the susceptibility to a conspiracy theory or believe in conspiracy theory that downplayed the danger of COVID-19 and was associated with the lower health compliance. It's still unclear if anxiety influenced the compliance to COVID-19 related health protocol in Universitas Airlangga student. For study using the cross-sectional research design with the population is from the Universitas Airlangga student, and we got the 400 samples from Slovene formula. The free variable is anxiety due to COVID-19 in student of Airlangga University, and the bound variable is compliance of Airlangga University student to health protocol. The demographic distribution of our population or our sample is first body gender. The male is 44% and the female is 69%. In the season of the COVID-19 pandemic mentioned that anxiety is significantly higher in the womb. With or within the 400 sample, the anxious people is 7% and anxious is 93%. In and the demographic patient is 68 from the non-Surabaya and 32 from Surabaya. The decision between anxiety in children in different dwelling, village or city has significant difference caused by the presence of environmental factors, knowledge and facilities that affect the anxiety. From the host, we found that the our uh, our 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 sample is live in the house. It's a 94% and boarding house is 6%. The difference between anxiety and student living in homes, boarding house, and apartment was no significant difference. This is related to the presence of social support in the home environment. Compliance level of subject with anxiety, we observe the compliance among hand-washing behavior, wearing mask, keeping distance, going off the house, touching the face, nose, mouth, using personal cutlery, consuming fruit and vegetable, vitamin consumption, doing exercise, and believing conspiracy news. We give them two types of survey sheets that randomly fill with the arranged statement, positive and negative statement. This will illustrate the uniform compliance trends, and the result of the negative statement are then reversed into positive statement. Then a chart is created, then the trend of protocol compliance in subject with anxiety is illustrated in the figure. Based on the diagram, we can see that the respondent compliance with anxiety varies greatly. Most of the anxiety respondents have always maintained the health protocol. Within the compliance level subject without the anxiety, as we see on the compliance diagram, with the respondent who did adult expenditure and anxiety, we calculated the correlation between 12 health protocol question and compliance. In respondents with anxiety and not, it was found that only the behavior of taking vitamin received significant result with the p-value of 0.002 with a coefficient on relationship is 0.144 and 7, which means that there is a relationship with a low correlation level between anxiety and multivitamin consumption. As we already know, the multivitamin consumption is highly increased due to the pandemic. As the result of our research, there's a point those with a higher fear score were those who had high compliance behaviors. Preventive measures like wear masks, etc., on the people behavior in avian influenza pandemic season in the Netherlands, then there are preventive efforts from people who have high level of anxiety. And the participant who spend more time engaging in outdoor physical activity had a lower anxiety. Poor diet in fruits and vegetables often occur during isolation due to low intake of antioxidant and vitamin. During quarantine, dads often take a step back from a healthy diet rich in fresh food to the food containing a long shelf life, such as consuming vitamin or supplement, and other long shelf life consumed like instant noodle and uh, can from the tin can. Respondent had satisfactory hand hygiene practice and avoided touching the source of transmission, poultry species, but did not use the other precautions. And there is no correlation between anxiety and trust on the healthcare conspiracy, limited research. So the conclusion is the existence of pandemic can cause the anxiety for some students of Universitas Airlangga. And anxiety related to COVID-19 pandemic can affect the level of compliance with the health protocol. There is a positive correlation between anxiety level and vitamin consumption levels during the COVID-19 pandemic. Further research is needed on anxiety and compliance with health protocols, especially during the massive increase in the number of cases that still occurs in many countries.